You're listening to an archived Cabral Concept podcast. After listening to this show, check out the most up-to-date podcasts available at stephencabral.com/podcasts or search directly on iTunes. And now, welcome to the Cabral Concept, where board-certified naturopath and integrative health practitioner Dr. Stephen Cabral shares how he was diagnosed at the age of 17 with a life-altering illness and given no hope for recovery. It was only after studying and traveling all over the world did he discover how to combine ancient Ayurvedic healing practices with state-of-the-art naturopathic and functional medicine to fully rebalance the body and re-energize it with life. It's time to discover how to get well, lose weight, and finally feel alive again. And now, here's your host, Dr. Stephen Cabral.
We're going to be going over our Cabral house calls, and these house calls are dedicated to me trying to answer our community's questions to the best of my ability, just as if I was to step into your home and I was to sit down with you and we would just have a conversation about your health. You asking any question that you would like and me doing my best on the spot to be able to answer that question. No preparation, just going from what I've learned over the past 20 years, 250,000+ client appointments, and thousands of books read. All of that to say, what I'm trying to do is use the knowledge that I've been able to accumulate from so many brilliant people that I've learned from over the years and from the practice that I've been grateful enough to be able to be a part of and share that information with you. So what I'm going to do right now is dive right into the show, and I'll tell you why. These questions are coming in from the beginning of November 2nd. This show will debut right around, well, I think it's the 21st or so. So if I'm looking at my calendar, yes, today is December 21st. So we are about 7 weeks behind. So I'm falling behind in shows and in the house calls, not because I want to, but because we get more and more questions. So what I'm going to try to do is do my best to refer back to previous house calls if I've already answered the question. This is very important. So if you have a question, I'm happy to answer it. There's no doubt about it. I hope to be doing this for the rest of my life. So what I want you to do, though, is just go to stephencabral.com/podcasts and type in your keyword, whatever the keyword is. And then if it comes up with like 30 results, well, try to see if there's an individual show on it or a house call. If there's too many results, narrow down the keyword a bit more. Maybe add one more word to it, and we'll see if we have a show specific on that. If you don't find your answer, if I haven't already answered it, then feel free to write in, and I'm happy to answer that. It's going to take about 6 weeks or so, hopefully not longer, to get to your question. I just want you to know that. It's about 6 weeks or so. So we are answering questions and starting with today's episode is stephencabral.com/1415. stephencabral.com/1415. I hope you'll follow along with the questions. All right, the first question is from Noel. So Noel writes in, "Hi, Dr. Cabral. I would love to hear more about Mimosa Pudica seed. After using it for 10 months, my girth has decreased. Wow, I think it's binding or scrubbing biofilm or mucoid plaque like crazy. Would love to hear more about your thoughts about this as part of the detox. FYI, I've ordered a few tests from Equilibrium Nutrition and will begin your 21-day detox very soon. I've also just begun the IHP certification program. I'm feeling energized by all that you offer and share. Thank you so much, Noel, and it's amazing to hear that you're in the Integrative Health Practitioner certification as well. So you must be reading our minds over here at Equilibrium Nutrition. So I'm the chief formulator for all of the products at Equilibrium Nutrition. Basically, my goal is to teach, educate, and formulate products and the protocols that I use in the real world in my practice. And then Equilibrium Nutrition is really separate from me. I mean, to be honest, it is a massive machine. It really is. We ship to countries all over the world. We're the very first company to be able to ship at-home labs internationally. It's unbelievable. And I say that out of like extreme pride for what my team has been able to accomplish. Not hubris or ego at all, but just like these are an amazing group of people, and especially like our executive team all the way down to our, someone who just, I don't know, we have as a freelancer doing code or silhouetting images for the website or taking photographs. Like it's an amazing team. Like, and I'm privileged to be a part of it. So we always better our best. So as part of our parasite protocol, now it doesn't mean don't do your parasite protocol now. It doesn't mean that, because we've been using the same parasite protocol for about 7 years and it works great. So as part of the new parasite protocol though, we will be adding Mimosa Pudica. And you'll see that first quarter 2020. So it's a great product. I don't believe that you should ever use it by itself. It does, as you say, it scrubs, it binds, it clings to, it removes a lot of the biofilm and potentially gut bugs, right? Parasites, etc. So here's the thing though. I absolutely still believe, you need a true biofilm disruptor with the proteolytic-based enzymes. That's the fluorofilm. You still need things like black walnut hull. You still need other things as well to help kill those gut bugs too, because those are clinically proven. So I'm a big fan of Synergist. Never one thing, but a big fan of Synergist. However, just to let you know, I'm an advocate of Mimosa Pudica as well. That's been used in many Ayurvedic and ancient Eastern-based wellness, medical-based programs over there too. So check that out. Look for it very soon. Thank you, Noel, for writing in. Erick's up next. I've been trying to remedy my vertical nail ridges, mainly on my left hand. I've been doing the DCD protocol, Dr. Ball Detox, and they haven't lessened. I have done SBO. I'm assuming that means CBO. I'm just going to type in CBO protocol. Heavy metal, intestinal cleanse, at least 6 months healthy gut, parasite, and eat clean. I take B vitamins, D, magnesium, C, probiotic. As you can tell, I'm a fan of your information, and it all has worked very well for me. Just trying to get to the bottom of why the body isn't absorbing nutrients. I'm a vata-pitta. Thank you for having the mindset on all that you do. Okay, so happy to help with this. What I'd like everyone to do is check out episode 634, the early warning signs of nail diagnosis. That's episode 634, way back in the day. That was year 2 of the Cabral concept. Check that out. Nail ridges was talked about on episode 632. So you have episode 632 to look at, 634 to look at. And do I recommend any other shows? Let's see. Episode 1215 as well. The 8 external signs of internal deficiencies. So check those out. Okay. Now, vertical ridges. A lot of people get confused by these. They're not as negative as horizontal ridges, which means they run perpendicular to how your nail grows out. Vertical ridges, thin vertical ridges, are a natural part of how the actual nail grows. It is not perfectly smooth. It may look perfectly smooth. Small, light vertical ridges are not an issue. I just want to state that. Thick vertical ridges are an issue. And it can have to do with multiple things. Many times, it looks a little different. Usually they're pitted, but it can be almost like a psoriasis of the nail. And yes, sometimes it is internal deficiencies. Erick, my highest recommendation, you've done so much, is to put your mind at ease. Keep taking the supplements that you're taking. Run the starter kit. Okay? The starter kit is the Candida metabolism and vitamins test. So we'll know if your vitamins are at the right levels. And then run what's called the minerals and metals test to look for heavy metals as well. And look at your mineral levels. That's also called the hair tissue mineral analysis. So those will put your mind at ease, but it sounds like you're doing a great job. It may actually be nothing to worry about, so sometimes it's just good to check. All right. Anonymous is up next. Hi, Dr. Ball. I haven't heard you talk about men's prostate. As a younger man in my 30s, I'm a bit concerned with the health of my prostate. Ever since I can remember, it has taken me longer than normal to begin urinating when I'm at the toilet, while others seem to be able to just fire away the second they unzip their pants. Also, it oftentimes feels like I don't entirely empty my bladder. I find myself getting up in the middle of the night to pee regularly. I'm a pretty healthy individual. I'm on your daily foundation protocol and regularly do moderate exercise. I've had chlamydia in the past, which I took care of through antibiotics, but still to this day, I can sometimes feel a slight burning sensation when I urinate. It's very hard for me to feel fully rested and rejuvenated, as I feel like my immune system is always a bit compromised. I also believe that I may have ringworm or some type of fungal infection of the skin, which has caused me to experience itchy anus. Overall, I just feel like something in my body isn't right, either mold, candida, virus, or some other type of low-grade infection that I can't seem to get rid of. I've done the parasite cleanse and 21-day detox. What would you recommend the next step is getting well? Thank you so much for all that you do. Anonymous, thank you for writing in. And so, yeah, maybe I should do a whole show just on, men's health, men's prostate as well. But here's the thing. So we have a product called Advanced Prostate Care that will absolutely help with balancing healthy levels of inflammation in the prostate. Why does that matter? Well, if your prostate's inflamed, it will actually squeeze on your urethra. So that will actually disturb the flow of urine while trying to urinate. So that's why. So that, because again, Anonymous, I want you to have the why of how all of this works. Because a lot of people, they just don't know. And so what happens is the prostate itself, it's hard to describe, almost like, I would say like a little tangerine with the ability to allow your urethra to move through. So urine as well as semen could move through that urethra. Okay, so why does this matter? Well, the more inflamed, the less space there is for urine to flow through. So very, very important for us to look at. One way that help men with prostate inflammation is they kind of push under where the prostate is up, and it allows for that full urination. So that's obviously not fixing the issue. What we want to talk about is this, though. It's always the why. So many men with you're onto it. Many men with candida or fungal-based issues can have inflammation of the prostate as well. I've also seen higher levels of cadmium or heavy metals displace zinc and cause inflammation of the prostate too. So a few things that we do is we typically use zinc picolinate, about 30 milligrams per day in addition to your daily nutritional support or daily foundational protocol. We use the advanced prostate support, but we want to go deeper. And for you, I definitely recommend the same starter kit that I just spoke about before. Now, it'd be great to run the Big Five. Remember, the Big Five is always the best place to start. You could have more inflammation. You might not be getting enough omega-3s. But what we want to do is, well, if you can't lab test, I would definitely do the CBO protocol. I would do that with the citracidal drops. I would do the CBO finisher afterwards. I would then do the heavy metal detox. And that's if you don't do lab testing. So again, I can't treat, I can't diagnose, I can't cure anything that's not within my scope of practice. I certainly can't make those recommendations to do that. But what I can look to do is rebalance the body. And these are definite places to start. Lab testing is going to give you a more clear, defined answer on what is going on with that gut as well, whether there is candida-based issues. Okay. Thank you for writing in. Holly's up next. Hi, Dr. Stephen Cabral. Thanks for taking the time to answer this question. I really love the podcast. I'm 37, have had one child 4 years ago. I've never had weight issues. Even after having my daughter, I bounced back within 6 months. In the last year, the weight has been piling on, particularly around the midsection. I eat a plant-based diet, exercise as often as I can, walking at least 10,000 steps a day, plus a bit of interval training when I can. My daughter and I are a very active family. I've noticed cellulite in the front of my thighs. Shocked as I've never had cellulite before. My skin appears to have lost elasticity on my legs. My hormones seem fine from a recent blood work test. My cycle regular now after having my daughter. Sleep isn't great. Digestive issues like bloating occur daily. I'm heavier than I was at 9 months pregnant. I've been under enormous stress for the last 2 years. I was just going to ask that. But things have gotten better recently. Any insight would be helpful. Thank you, Holly. All right, Holly, I was literally just going to say this looks like a case of stress and catabolism. To me, again, you can't just go to your doctor and run blood work for hormones. It has to be between days 19 and 21 of a female cycle, and it should be a 24-hour with the saliva included in addition to blood. We call that our mood metabolism stress test. You can find that at equilibriumnutrition.com. Used to be called thyroid adrenal hormone. That will be giving you stats on your thyroid, estrogen dominance, higher levels of cortisol, which you very well may have, especially at night, lower levels of vitamin D. There's so many things to look at. You might have dysregulated blood sugar. So I can give you the answer. It would take about a half hour. Instead, there's a podcast on this. So, well, here's the thing. Actually, go to stephencabral.com/BRMI. That's a presentation I did between stress and weight gain. It's basically going to answer your question. All right. The other one that you can look at is why cellulite. I just talked about this on yesterday's Friday review on a podcast I did with Melissa Ambrosini, but also I have one on my site that gives you all of the ins and outs of cellulite. And let me see if I can find that for you. There's 15 results. I went to stephencabral.com/podcast and I typed in cellulite, just like you would do, because honestly, I don't have all these shows memorized. Today is episode 1415. So I need a little bit of help just like you. So this is episode 221. How to get rid of cellulite. stephencabral.com/221. Okay. So there we go. Your answer is at stephencabral.com/BRMI and episode 221 for cellulite. But I can assure you, after looking at those, you'll understand how cortisol, elevated levels of that stress hormone, actually raises blood sugar even if you're not eating carbohydrates. And as you raise insulin and blood sugar, essentially, blood sugar comes first, then insulin, you store fat around the midsection. I mean, it fits you perfectly. Again, I can never be 100% sure until we lab test, but that looks like it right there. Again, like that is it. That's targeted right in there. So we would begin with the deep sleep protocol. We'd be using full spectrum magnesium. We'd be using adrenal soothe in addition to the daily foundational protocol. But I would love for you to lab test, work with one of our health coaches, get their one-on-one recommendations. I oversee all the labs. That's the best, but you can also go with those recommendations too. Okay, John is up next. Hi, Dr. Cabral. I'm interested in becoming a functional medicine doctor. I'm having a hard time deciding between naturopathic and osteopathic schools. Could you talk about the pros and cons of both and what you recommend for people looking into for functional medicine practice? Yeah, let me check to see if I've recommended this before. So things have changed a lot since I went back for my degree, and I want you to naturopathic, and I want to give you the best information possible. So again, I'm just going to stephencabral.com/podcast. There we go. So it's 11 search results. So let's see if I can find it. It's going to be on a house call because I wouldn't dedicate a whole show to it, but certainly worth me having the discussion about this. Health School, episode 995. So that should be 1. How to pursue a health career, episode 1268. That would be a good one for you. Actually, that would be a really good one for you, John. Episode 1268. So 995, 1268, and then all of the naturopathic schools that are now licensed schools. We can become a naturopathic doctor. There's actually a couple great ones in Canada, and then there are about 6 in the United States now. So let's see if I can find that for you as well. Okay, so if you go to aanmc.org/naturopathic-schools, you'll be able to find the 6 accredited naturopathic programs that I just spoke about, and then also the one in Canada as well. Why don't I go over them right now? So there's Bastyr University. They're in Seattle and San Diego. There's the National University of Natural Medicine in Portland, Oregon. There's the Southwest College of Naturopathic Medicine and Health Studies in Phoenix, Arizona. There's the National University of Health Sciences in Chicago. And then there's the University of Bridgeport of Naturopathic Medicine in Bridgeport, Connecticut. Then in BC, Vancouver in Canada, there's the Boucher Institute of Naturopathic Medicine and the Canadian College of Naturopathic Medicine in Toronto, Ontario, Canada. So all of those are going to be accredited. That's going to allow you to become a licensed naturopathic doctor if you choose to. And then osteopathic schools, there's many more of those. So what can I tell you about the differences? Well, again, I'm not a master of osteopathy, so I can tell you that. But I've got a nice big textbook here that I love recommending, an osteopathic approach to diagnosis and treatment. And an osteopathic doctor can be a primary care physician. A naturopathic doctor can be a primary care physician in some states. So here's the thing for me, though. Again, this is one person's opinion. This is one person's opinion. That's it. If you would like to practice as a primary care physician and use all sorts of, you also use antibiotics and all sorts of different things like that, I would become a medical doctor or an osteopathic doctor, okay? If you want to go more into the field that I talk about, I'd recommend becoming more of a naturopathic doctor. And the reason I say that is that it lends more towards that. Osteopathy is a really nice mix between chiropractic, soft tissue manipulation, really understanding the autonomic nervous system, as well as becoming basically a medical doctor, because they are essentially a medical doctor. They're a DO instead of an MD, but still primary care physician, okay? Still licensed, all that. So it's hard for me to pick one or the other. I would really listen to the episode that I did. That was Health School Advice 995, and then Pursue a Career in Health 1268. Because I just feel at the end of the day, sometimes it's really better for people just to become a level 2 integrative health practitioner. Meaning that you could accomplish that in a year instead of 4 years. You could continue your own study outside of that. And you're helping people, I don't know. I mean, I guess I'm biased, of course, but you're helping people to such a great degree. You're not their primary care physician, you're a health coach. But it's also sometimes easier to practice as a health coach because you don't need to do the physical exam. You don't need to, you can work across state borders. I don't know. It's something to think about. I can't give you a great answer on this. The bottom line I always say is you have to listen to your heart. Like, what's your heart telling you to do? Don't do it for the money. Believe me, you want to do a career. It's a demanding career, okay? It is a demanding career. You have to absolutely love it. You have to absolutely love working with very sick people, okay? You have to love that. And if it's not what you love to do, then do something more in the health coaching and fitness-based area where you're working a lot with preventative-based and you're working with health-based issues, but not maybe people with cancer or, a really harsh-based condition. So anyway, I'm not trying to sway you. Follow your heart. It's the best thing that I can say. I can't give anybody else any advice besides that. I knew exactly what I wanted to do, and I pursued it. My mentor guided me, but she didn't tell me what to do. And that's the best that I can do for you as well. So hopefully that was helpful. I'd love to be able to answer one more question quickly if we can. All right, this one's from James. Hey, Dr. Cabral, just want to get your opinion on something I was thinking about today. It seems clear to me that ancient civilizations, traditions, and medicine were in many ways far more advanced than we are today, and with all the wonderful technology we have. Relating it back to health, Hippocrates once said, all disease begins in the gut, something we seem to be discovering only now. In Ayurveda, mint is known to be cooling to the body, and I recently heard that in some studies, peppermint tricked the nerves of the liver into thinking it was cold and induced hepatothermic abilities. I'm just curious to hear your opinion on why and how they knew so much so long ago, particularly with your expertise in Ayurveda. Was this stuff just trial and error? I find it hard to understand how they had this knowledge without testing capabilities we have today. I guess that's $1 million question. Hey, I just wanted your opinion as someone I highly respect. Thanks, Dr. James B. A fellow doctor, we appreciate you, James, writing in. So here's the thing, James. Blows my mind every day. You can't learn all this through trial and error. There's no way. There's no way. There had to be another way. And I don't want to get conspiracy theory, and I don't want to get all woo-woo, but every time I've been in India, Sri Lanka, studying ancient-based herbalism with anybody, every single time, the ancient yogis and Vedas, which are the Ayurvedic doctors, they say spoke with the plants. Okay, I know that seems so woo-woo, and I get it. Like, listen, I'm a science-based person. I can't see how that's possible, okay? I don't understand it. But I think what they were really saying, and we see this through people who go into deep meditative states, there are things that we don't know yet about the mind. And it's very possible that 10,000 years ago, Ayurveda started getting written down on scrolls 5,000 years ago or so, but it's very possible that people were more in tune with nature back then, that they understood things in a different light, that they were able to go into deep meditative states, maybe even with the help of plant-based medicines, as they're called, and begin to understand which plants were used for which. Besides that, how could you possibly contemplate what to use for a headache, what to use for this, what to use for this? There are, I can't give you the name, I can't give you the number, but what? 1 million different plants to choose from? I don't know the number. And how would you know that the seed is used for this, the root's used for this, the flower is used for this? There is not enough time on earth to be able to know that and independently experiment with it. So James, it's a great question. I'm getting a little metaphysical right now. I don't know. No one knows. I'm not sure if we ever will. I really don't know that. But I believe that there's certain levels of intelligence. There's a level of intelligence with a brilliant researcher, like the people who come up with all of these different theories on health and they get proven true. That's one. There's engineer-based brilliance. But there's also the brilliance of being able to tap into a different level of intelligence that we don't fully know. So I don't want to go beyond that, but my answer is I don't know. I honestly don't know. But they did. And I'm so fortunate now that they wrote it all down and you can go in depth on this. And now we're beginning to see all of these things proven out in research. It's unbelievable. So I'm in awe, just like you, Dr. James. I appreciate you writing in. Thank you, everyone, for writing into the Cabral Concept, for listening to the Cabral Concept, and for your support. We're now over 1,000 reviews on iTunes. I appreciate you leaving your reviews for the show on Spotify, on any different app that you listen to podcasts on. Thank you so much. Again, your support means the world to me. Take care. If this show is helpful, please do feel free to pass it along to anyone you believe it will serve. Before you go, I wanted to share a personal story with you. The real reason I began to get well finally is because I figured out what was wrong with me. And that might seem pretty obvious, but I went from doctor to doctor for over 2 years before discovering at-home functional medicine lab testing. These are the labs that enabled me to finally figure out what was wrong with my hormones, blood sugar, electrolytes, and gut health. And once I knew what was wrong, I could then follow a proven plan in order to rebalance my body from the inside out. This is why I believe so strongly in functional medicine lab testing and why I've made it my mission to share these labs with the world. Now at equa.life, you can order an at-home lab test or lab bundle for you and your family and be able to complete it within the week. Plus, the EquaLife difference is that you're not left to try to read and figure out these labs on your own. We explain what your lab numbers mean, what they mean in the much bigger picture, and then how to go about rebalancing your body in order to heal. To see our full selection of lab tests, or to set up a free lab selection call to find out what labs may be best for you, simply head on over to equa.life/labs. And do remember, we ship these all over the world. To find out more and to set up your free lab selection call, simply head on over to equa.life/labs. That's EQUI.LIFE/labs.